Day hospitals seems like such an overlooked mechanism for the healthcare industry, and it can plug so many gaps, and because it's so agile. And one of the things that came up was hospital ramping. It could
Yes.
alleviate that, which seemed to really be exacerbated after the virus and
Yes.
the outbreak. So yeah, how would you go about that?
Well, there's a couple of reasons for ambulance ramping. One is elderly patients who decline while they're particularly in the public sector, we're talking, who decline and need to go into care and there's nowhere to put them. So that's a problem. However, the government, as you know, is looking at aged care packages in the home. That could be a solution where carers come into the home, but also the number of same-day procedures that are being done in the overnights is taking staff, admission staff, theatre staff are all involved in that. So that's reducing the capacity for the hospital to take patients. The other problem is that in the private sector, those hospitals that have EDs, the ED treatment is not covered by the private health insurer. Only the doctor's fee, not the ED treatment. And yet the hospital has to provide nursing staff, equipment, everything else. So that's another flaw in the system. So the other way that ambulance ramping in the public sector could be addressed is by outsourcing a lot more care to both the day hospital sector and the private hospital sector. Day hospitals are not being used as they could be. And in fact, I met with Peter Dutton about a week ago, and that was his prime concern was the amount of the length of waiting lists and waiting time for patients in the public sector, and the fact that our sector is not being used as much as it could be. And it's so efficient, you can get through a lot more work. But all the outsourcing has tended to go primarily to the large overnights. There is some going to day hospitals, but not as much as could be.